This is Professor Madero, and I wanted to give you a summary of the introduction to medical coding. This is just a summary. Please go back and read your lectures that are in all of your units just to confirm that you understand. And this video is for reference only, mainly to help you with your first assignment. So many of you may not understand what happens in medical coding, so we're just going to give you a brief introduction. These are a couple of the highlights we're going to cover. Introduction to code sets using medical billing and coding, the difference between diagnosis and procedures, and differences between the diagnosis and symptoms, and also we're going to go into some details of the ICD-10-CM code set. There are 4 medical code sets that we use in reimbursement. You should have received 4 coding manuals. The ICD-10-CM, which is diagnosis coding for all healthcare encounters. That means it's used for inpatient hospital, outpatient procedures, medical offices, mental health facilities, long-term care, any healthcare encounter. This is the only diagnosis code set. And that's what we're learning about in this class. The second code set is also an ICD-10. However, it's for inpatient procedural coding only. We will have a class on this. This will be your last class, coding class, besides your practicum. CPT class is procedural coding for professionals and technicians. And this is for doctors, radiologists, labs, anesthesiologists, surgeries, different things like that. And the HCPCS codes, it's HCPCS is known as HCPCS, and they're codes used for medical supplies, transport, drugs, and other medical codes. And we're going to cover this in your next class. So it's important to understand the difference between a diagnosis and the procedure. The diagnosis is the reason why the patient is seeking medical attention and healthcare. The procedure is actual medical treatment performed to improve the patient diagnosis. For example, a patient presents with lung cancer. A bronchoscopy is performed to clear the airway so the patient can have a clear airway. What is the diagnosis? Well, in this case, it would be the lung cancer. And what is the procedure? This is the bronchoscopy. All right. So let's go more into the code structure. For diagnosis codes for all healthcare encounters, okay? The first character is always an alpha character. The alpha character is always capitalized. That's very important, always capitalized. And it represents one of the 21 different chapters that are listed in your code book. You're going to learn about the chapters as you go on through the units, but that's how they're related. The second and third characters are always numeric. None of them have alpha. Okay, a period is added after the third character if the code includes characters 4 or more. That's important. Some codes, the minimum characters a code can have is 3. Let me repeat that. The minimum number of characters the code can have is 3. The first is an alpha code, which means it's alphabetic, and the next 2 are actually numeric. Okay. The 4th character to 6th character can be numeric or alphanumeric. It just depends on the coding guidelines, which we're going to look at as well. Each additional character, including character 4 through 6, adds specification to the diagnosis code, and you'll see that in your coding manual as well. And the 7th character is extension. We're going to talk about that in a minute. So, a diagnosis versus a symptom. The key to successful diagnosis coding is don't code the symptoms. A symptom is a side effect of the disease or condition. For example, patient presents with vomiting due to sinus infection. Vomiting is a symptom, while the sinus infection is the diagnosis. So let's take a look. Patient presents with upper right quadrant pain with excessive gas. Through further examination, gallstones are present. What are the symptoms? Well, upper right quadrant pain with excessive gas. Okay. Further examination, gallstones are present. Which is the diagnosis? Gallstones. Now you'll see in your homework, it says a patient has pain, but it specifically says it's post-operative pain. If a patient presents with pain, that's a side effect. But if it says specifically pre-operative pain, that means that that is a diagnosis. So what is a diagnosis? Let's confirm. ICD-10 or CM codes are diagnosis only, and diagnosis can change depending on further examination of the patient. There are several types of diagnosis. For example, if you have an outpatient encounter, let's say, going to a medical office, it's called the reason for the encounter, and that's the diagnosis. Procedural diagnosis, you'll find this on the operative report. And admitting diagnosis, this is the reason why the patient was admitted to the hospital. So there can be several different types, and depending on the encounter type, that's what we call it. For example, patients admitted for excessive menstrual bleeding after a laparoscopic procedure, it is determined that the patient has uterine cancer. The admitting diagnosis is menorrhagia, which means excessive menstrual bleeding. But the final diagnosis, which is the procedural diagnosis, is uterine cancer. Okay. So in your manual, you will find the following tables. The first is the alphabetic index. The alphabetic index is an alphabetical listing of all main terms. Diagnosis are main terms, okay? And when you find your alphabetic index, you'll find that all the main terms are in black, and you'll have subterms which are tabbed a little bit, like they're indented, and they're not in bold. And this provides a little more specification. For example, if you look up fracture in your alphabetic index, your sub heading could be ankle, could be wrist, could be tibia. It could be a variety of different things. So it provides more specification. And once you're in your alphabetic index, once you find a code, it might give you a code or code range. That's when you go into the tabular list. Now, the tabular list is organized alphabetically, again, by chapter. And once you get in the right, you look up in your tabular list the correct letter, alpha letter, then it's organized by numbers. So, and remember, it's 3 digits, so it goes from 00 to 99 all the way through. And then it goes further specification and guideline. This is why it's so important to make sure that you go into the tabular list to confirm that you have the right code. Okay. You also have these other tables as well: indexes to diseases and injuries, tables of drugs and chemicals, and external causes of injuries index. And these are just smaller references, because if you go in the alphabetic index, it can be a wide variety of codes, but you can, if you have these specific, issues, then you can actually look them up specifically in there. Like, for example, when you're looking for place of occurrence or external cause of injury, you could use the external cause of injury index. So what are the steps, the accurate steps? Okay, use your manual. Don't Google it. Why? Because you need to keep your manual in order to take your CPC or CCA exam. And when you're in the exam, you're not going to have access to the internet. So you do need to know how to use your manual. Open your manual to the alphabetic index. Make a note of the code or code range that the result gives you. Look up the code or code range in the tabular list. The tabular list contains the code descriptions, and the code description should match the documentation exactly. Compare the details in the code description to the documentation. Don't add any details, only code what's present. For example, if I have a type 2 diabetes patient, but it doesn't tell me if the patient had a stroke or if the patient was in a coma, I can't add any of that information. I can only code what is documented. Okay. Number 2, never code from the alphabetic index, even if it just gives you one code. Always check in the tabular list for the description and coding guidelines. It's important for you to understand what the coding guidelines are. They are described along with the code in the tabular list. The alphabetic index does not have any of that. So you want to check also the guidelines at the beginning of the chapter. Remember, I mentioned the character will represent a chapter, and there's specific coding guidelines for the chapter. So once you have a code for that chapter, not only are you looking at the coding guidelines for that code, be sure to take a glance at the beginning of that section, that chapter, to make sure that you covered all the coding guidelines. Okay. For example, at the very beginning of chapter 13, a musculoskeletal or M code chapter, you'll see several notes, including the one below. So you can go and look at those. For example, this is something different. First listed diagnosis. Now, this is important for you to know because as a coder, sometimes we have multiple codes. We have to know which one is first listed. This is given in the coding guidelines in the tabular list. Okay. So, first listed diagnosis, if you want a reference in your ebook, it's on page 56. In the outpatient setting, the first term listed diagnosis is used in lieu of principal diagnosis. We talked about principal diagnosis. In determining first listed diagnosis, the coding conventions of ICD-10-CM, as well as the general and disease-specific guidelines, take precedence over the outpatient guidelines. The most critical rule involves beginning the search for the correct code in the code assignment through the alphabetic index. We already talked about that. Never begin searching initially in the tabular list, as this will lead to coding errors. Okay. Use of Z codes. Z codes you will use on your first assignment, and these can be used for any healthcare setting, whether outpatient or inpatient. Z codes can be either a first listed or a secondary code, depending on the circumstances of the encounter. Z codes are most often assigned in the outpatient setting, that is ambulatory care centers, physicians' offices, and outpatient department of hospitals. Okay, these are the 4 circumstances. When a person is currently sick, when a person who currently is not sick encounters the healthcare services for a specific purpose, for example, to act as a donor of an organ, or to receive a preventative vaccination, or to discuss a problem that itself is not a disease or injury, occurrences such as these are more common with outpatients at health clinics. Number 2, a patient with a known disease or injury receives health services for specific treatment or disease or injury. Number 3, a circumstance or problem is present and influences a patient's health status, but is not in itself a current injury or illness, or to indicate the birth status and outcome of the delivery of a newborn. There's also observation codes, so keep that in mind when you do your homework. And finally, assigning a 7-digit code. Remember, we could have 7 digits with a period after the third character. And remember, we talked about the character 7 being an extension. How do we know that an extension code is needed? There's a symbol in front of the code in the tabular index. Some publishers use a red check mark in front of the code. The other ones use a short dash. Okay, so what if you don't have character 4, 5, or 6, but you need a character 7? Whatever characters you don't have, you put a placeholder X in there. Okay, I know we went through a lot of information, but if you have additional questions, please send me an email. Thank you so much for joining.